Estou começando o programa Infertilidade em Foco, diretamente da TV Faz, Rio de Janeiro, Brasil. E hoje estaremos recebendo no nosso programa um convidado muito especial. Ele que está representando o país Estados Unidos da América, Dr. Ayman Attar. Dr. Ayman, ele é especialista em ginecologia cosmética, uma especialização que está em alta, extremamente inovadora. Dr. Ayman, ele é presidente do American Board Cosmetic. Também é fundador do Dermalaser New Jersey. O nosso convidado, Dr. Ayman Attar, que é um médico e cirurgião estético renomado mundialmente. Ele irá apresentar uma palestra fantástica, falando um pouco sobre a ginecologia regenerativa e funcional e sobre infertilidade. Vamos assistir?
Hello, my friend in Brazil. This is Dr. Ayman Attar from New Jersey, United States. I'm currently the president of the American Board of Cosmetic Gynecology. In this talk, I would like to share with you some significant topic about the relationship of the emerging field of cosmetic gynecology, what we call regenerative and functional gynecology, and a very, very common problem that affects a lot of people, which is infertility. Infertility is a disease of the male or female reproductive system defined by the failure to achieve pregnancy after 12 months or more of regular unprotected sexual intercourse. It could be primary or secondary. Primary infertility when a pregnancy have never been achieved, while secondary infertility usually at least one prior pregnancy was successful. Fertility care encompasses prevention, diagnosis, and treatment for this infertility. Infertility have got a new expanded definition to address the reality of all. Seeking care medical group says as recently as in October 2023. So the new definition is inability to achieve successful pregnancy based on the patient medical, sexual, reproductive history, age, physical findings, diagnostic testing, and combination of those factors. The incidence of infertility is about 17.5% of adult population. 1 in 6 people worldwide will experience infertility, showing the urgent need to increase access to affordable, high-quality fertility care for those in need. The new estimates show a limited variation in the prevalence of infertility between regions. So female infertility constitutes 33%, male infertility 20%, unexplained in 8%, while combination of factors usually happen in 39% of the cases. When it comes to female infertility, we can find many reasons, including congenital anomalies, urogenital infections, immunological factors, fallopian tube damage, ovulation failure, presence of endometriosis, abnormalities or congenital anomalies of the uterus, endocrine disturbances, and sometimes it's unexplained. We don't know really why a woman cannot conceive. While for male infertility, we found that 34% of cases of male infertility cannot be explained. 8% happen in undescended testicles. Urogenital infection cause 9% of these cases. Sexual factors are contributing in 6%. Severe systemic disease in 3%. Presence of dilated varicocele veins in 17%, hypogonadism in 10%, immune system factors in 5%, So how can aesthetic and functional gynecology aid in fertility? Aesthetic functional gynecology encompasses different procedures improving the appearance and function of female genitalia. While its primary focus is often cosmetic and functional enhancement, it can impact and improve the causes and the mechanisms of infertility. For example, penetration disorders known as genitopelvic pain or penetration disorders involve difficulty with vaginal penetration during intercourse, can include pain, fear, pelvic floor spasms. These disorders can significantly affect sexual health and relationships and minimize the chance of successful fertilization. Most infertility specialists would undergo assisted reproduction, like intrauterine insemination under anesthesia, or IVF for such couples ignoring the significance of sexual intercourse or for marital stability. Botulinum toxin injection to relax the pubovaginalis muscle or the muscle around the orifice of the vagina have been proven to be effective tool in outpatient setting or in case of advanced stage 4 of vaginismus, we can do it under anesthesia. Botulinum toxin injection is injected above the hymen in certain spots to relax this muscle and allow a successful, painless penetration. The result can last for several months after the treatment, and the treatment rarely need to be repeated if normal sexual intercourse is successful. So the other option that we use as well in cosmetic gynecology is the utilization of what we call platelet-rich plasma therapy, which involve using up to 1 million platelets prepared by an FDA-approved system. And it can be used in different applications, including the O-shot, injecting it in the clitoris area after anesthesia, or in the G point inside the anterior wall of the vagina, as well as enhancement of the labia majora, which act as cushioning during the sexual intercourse. Increasing the libido by platelet-rich plasma injection, which result in increased blood flow to the clitoral complex, will lead to more libido and more frequent intercourses. Enhancing the pleasure during intercourse lead to reflex contraction of the uterus during orgasm, which facilitate the sperm transport through female reproductive system, as well as it improves lubrication and aids in healing the vaginal atrophy that happen in some patients with low ovarian reserve. It improves the aesthetic appearance and firmness of the labia majora and minora, boosting female confidence and self-esteem and sexual well-being. It was published in 2012 by my colleague Michael Goodman in California. The satisfaction rate overall is 90 to 95%, and the sexual satisfaction is 80 to 85%. Another procedure that we perform in cosmetic gynecology or plastic gynecology is labiaplasty, which is simple reduction and reshaping of protuberant labia. I'm honored to have my own classification of labia minora hypertrophy, in which I describe the labia minora ideal width to be 1/3 of the length in a particular patient. Anything above this 1/3 constitutes some form of labia hypertrophy that can be of different varying grades and require a kind of intervention to reduce the size. The labia minora in a woman function to protect her introitus or orifice to the vagina to reduce the infection, as well as it is a sexually sensitive skin that helps with foreplay and get her wet during the coitus, as well as streaming of the urine. So typically, it does not affect fertility as it involves external genitalia, but it is a must for the process of successful sexual intercourse with the partner. The aesthetic procedures will boost the sexual confidence and might aid increasing and decreasing the dyspareunia resulting from this redundant part of the external genitalia that can be inverted inside the vagina during intercourse, causing discomfort to the patient. Another issue that we see as well is premature ovarian failure, which is a condition where the ovaries cease to function properly before the age of 40. This leads to reduced estrogen production and irregular absent menstrual cycles, which can result in infertility and other health issues. Platelet-rich plasma and stem cell therapies have been explored as a treatment option for premature ovarian failure or primary ovarian insufficiency. Platelet-rich plasma as well is derived from the patient's own blood. It's autologous, rich in growth factors, and promote tissue regeneration. The follicular development can be stimulated by platelet-rich plasma that stimulate the dormant follicles to develop, potentially leading to the resumption of normal menstrual cycles and natural ovulation. It might restore hormonal function, increasing estrogen levels. Some studies suggest that platelet-rich plasma might improve fertility outcomes with women with these conditions. So we have ultrasound guided approach where we apply the platelet-rich plasma, adipose-derived mesenchymal stem cells in the ovaries, or we can use laparoscopic approach with laparoscopy. For the endometrium, platelet-rich plasma have also been explored for its potential benefits in the uterine cavity, especially in conditions like thin endometrium or recurrent implantation failure in fertility treatments. The thin endometrium can be affected by the platelet-rich plasma, which help to improve the trophism of the endometrium and can help in aiding implantation of the embryo. Implantation failures used in patients who have multiple failed IVF cycles, this can definitely be a guide and a help to implant these ova, as well as in synechia or inflammation of the endometrium, what we know as Asherman syndrome. So we can simply inject the platelet-rich plasma via an insemination catheter into the cavity of the endometrium, or we can use a hysteroscope or a camera inserted inside the uterine cavity. So the uterine PRP trials, more robust large-scale clinical trials are underway to better understand the efficacy of platelet-rich plasma in uterine conditions. Research aimed to refine platelet-rich plasma application, preparation, and improve the outcomes. Hormone replacement therapy and infertility, especially in women with low ovarian reserve, then benefit from oocyte preservation through freezing or cryopreservation. Cyclic estrogen, progesterone is vital to preserve the functioning endometrial cavity and prevent uterine atrophy until the oocytes are fertilized and embryo transfer is performed. DHA supplementation improve the ovarian function, increases pregnancy chances, reducing aneuploidy, lowers miscarriage rates, over time appears to objectively improve ovarian reserve. Growth hormone as well is investigated through improving oocyte quality in elder women. Tibolone may improve the symptoms of low sex drive and vaginal atrophy in patients with premature ovarian failure. Tribolus terestis supplementation may improve sex drive in women with low libido and stimulate the production of FSH, follicular stimulating hormone. As far as the male infertility, we perform the Priapos shot discussed by my colleague Charles Reynolds in Alabama, where we inject the platelet-rich plasma in the corpus cavernosum for erectile dysfunction and can combine that with 50 units of Botox in every corpus. Intratesticular injection of autologous platelet-rich plasma may be considered as an alternative treatment strategy in men with non-obstructive azoospermia who failed treatment in randomized controlled studies needed to determine BRB through clinical efficacy and effect on subgroups of those patients affected. So just to take home message, platelet-rich plasma stem cell offer benefits of infertility, enhancing sexual experience in both men and women, offering future role of patients with premature ovarian failure, endometrial dysfunction, and testicular dysfunction. Hormone replacement therapy of women, although aims to improve women's quality of life, can also be beneficial in aiding women fertility and sexuality. Aesthetic function gynecology and regenerative medicine is not merely an aesthetic procedure, it is functional and regenerative. It has a pivotal role in enhancing sexual function and increasing infertility. Botox injection have been proven to be beneficial in patients with vaginismus as well as in patients with clitoral dysfunction to improve the erection during intercourse and help to improve the sexual drive and the chances of getting pregnant. Thank you very much for being good listeners, and hopefully we'll meet soon in Brazil. Thank you.
Vocês gostaram da palestra de hoje? Espero que sim. E agora teremos uma entrevista exclusiva com o Dr. Ayman Attar, falando um pouco sobre a ginecologia cosmética, que é uma área da medicina que cuida da saúde íntima, funcional e estética da mulher. Dr. Ayman, eu gostaria que você falasse conosco um pouquinho sobre os tópicos abordados no curso que você ministra no mundo inteiro sobre a ginecologia cosmética.
Hi, this is Dr. Ayman Attar again. Regarding the topics involved in functional gynecology, as it is an emerging new subspecialty since the past few years, because it's meeting the demand of this aging population. More than 1.1 billion women right now are afflicted with menopause, with different kind of problems like vulvovaginal atrophy, stress-related incontinence, and so forth. So cosmetic gynecology, as a fellowship that's organized by the American Aesthetic Association and the American Board of Cosmetic Gynecology here in the United States, aims at educating gynecology residents and specialists on a 4-day program. The two first days covers the non-surgical portion of functional gynecology, including the surgical anatomy of the female genital area and male genital area as well, including genital bleaching, the treatment of vaginismus utilizing botulinum toxin applications, different specialty, different aspects, including overactive bladder and as well as orgasmic dysfunction. We talking as well the use of fillers in this area to enhance orgasmic dysfunctions and to improve the outlook of the female external genitalia as well. We talk about energy-based devices, including lasers, carbon dioxide, erbium, and 1470 nanometer, as well as the high-intensity focus ultrasound, radio frequency, and light-emitting diodes or LED applications, as well as plexer or plasmage. We talk as well about the use of carbon dioxide gas in what we call carboxytherapy application in this area. And the second day would be as well as the platelet-rich plasma. The second day usually is a hands-on clinical training with doctors in different countries where we run the program, where we have actually volunteers to cover the different applications taught to the doctors, and they can see it as a demonstration collaboration with local faculty in every country. This week, I'm flying tonight to Riyadh. We have a fellowship of cosmetic gynecology in Saudi Arabia. then followed by 2 days in Thailand, where we have the Taga Congress, Thailand Aesthetic Gynecology Association Congress, where we're going to have actually workshop and cadaveric workshop as well. Then I fly to Manila, Philippines, where we have this same class at Makati Medical Center, covering both steps. Step 2 is a surgical step, and it covers all the surgical applications we use in functional gynecology, including the most popular labiaplasty, hood reduction, perineoplasty, as well as fat grafting to the genital area as a part of regenerative treatments of this nature. So hopefully we'll run the same class in Brazil sometime soon, and we'll meet our Brazilian colleagues. Thank you very much.
Outro fator que contribui para a infertilidade é a disfunção erétil. É bem constrangedor e emocionalmente pode abalar a parceira quando ocorre a disfunção erétil durante o ato sexual. Então, eu gostaria de saber se o homem com pressão alta ou cardíaco, como que ocorre essa disfunção e qual a forma de tratamento. É comum o homem de 30, 40 até 45 anos ter esse problema e como pode ser tratado?
Regarding male rectal dysfunction, it's a very disturbing condition for affected patients. 350 million men are dealing with erectile dysfunction. Etiology of erectile dysfunction can be variant, could be hormonal due to deficiency of free testosterone, or could be most commonly endovascular disease due to endothelial pathology in the corpus cavernosum of the penis. Many conditions can cause this erectile dysfunction, including diabetes, including hypertension, that can cause 8.5% of those affected patients to have erectile dysfunction. And the management of erectile dysfunction should rely on diagnosis of the etiology, whether it's hormonal or otherwise. Definitely sildenafil or Viagra is a very most popular treatment that a lot of patients are taken, including other variant forms of pharmaceutical products like Cialis and or tadalafil. Other options include intracorporeal injection like Trimix, which requires first ultrasonography of the corpus with Caberjack to make sure that the patients are appropriate candidates. Usually the first treatment is done in the office under doctor's supervision, and then we teach the patients how to insert that injection into the corpus and alternate it between two corpora cavernosa. 70% of patients find it very intimidating to inject themselves with a needle, but believe it or not, it is much more safer than using oral medications that can sometimes be ineffective. Usually we don't recommend using Trimix or intracorporeal injections more than 3 times a week. And in case the injection is done, you should never repeat it within 24 hours. If patients are failing this treatment, then the other option would be penile implants by a specialized urologist. So that can solve the problem of affected patients.
Dr. Ayman, para que as mulheres se submetam a esse tratamento de ginecologia cosmética, há algum empecilho?
Regarding the functional gynecology and cosmetic gynecology, actually it is suitable for all patients. We have 3 major contraindications for these kind of therapies. The first contraindication, sick people. If patients have any other problem, including diseases like sexually transmitted disease, uncontrolled, or endometriosis, or menstruation disorder, and so forth, Then we have to treat the condition before jumping into functional gynecology. The second contraindication, I would never do that on a pregnant or a lactating lady until patient have already have their babies. And third and most significantly is patients with body dysmorphic disorders. Body dysmorphic disorders in general population ranges between 1.8% and 2.5%. But body dysmorphic disorders in cosmetic patients, whether it's cosmetic gynecology or cosmetic surgery or plastic surgery in general, can be up to 20%. So you have to be careful dealing with these patients because this can be a very troublesome relationship. And there's always warning signs. Patients have unrealistic expectation. Patients are not listening to the doctor. They're interfering with the examination. They're always referring to other people's opinion rather than her own opinion or her partner request to do certain procedure. If those three contraindications are excluded, I think most of the patients can benefit from functional gynecology, taking the appropriate measures depending on the problem.
Doutor, sobre o vaginismo, qual é a forma de tratamento e os resultados esperados?
Hi. Regarding a very important topic about vaginismus, which is a very common condition, almost affecting 1 in every 5 women. It is actually vaginal penetration disorder that has different grades. Grade 1 is a mild discomfort where patients are unable to experience pleasurable experience. Grade 2 with its actual pain, but during examination of the patient, usually they don't have any guarding or they lift their buttocks off the examination table. Grade 3 when patients actually have severe pain, but the partner does not stop. And when you examine those patients, usually they lift their buttocks in guarding. While grade 4 is the most known for inability to penetrate, like hitting a brick wall, and this can lead to inability to consummate marriage and devirginate the bride. Botulinum toxin has been used since 1997 by Wagner and Bren to treat this condition. Recently, I have written a chapter in Cosmetic Gynecology textbook on the use of botulinum toxin type A for treating the condition. And of course, there is dosing schedule. Usually we use 50 units for grade 1, 100 units for grade 2, 150 units for grade 3, while grade 4 we use 200 units placed in a particular position so will not affect other sphincters in the perineum, including the urethral sphincter and the anal sphincter. The success rate of these techniques are very high, and the results are permanent, so we don't need to repeat the treatment once the patient have a pleasurable sexual experience.
Eu quero agradecer também aos telespectadores por estar acompanhando toda semana o programa Infertilidade em Foco. Eu tenho recebido muitas mensagens, muitas perguntas, e no próximo programa estarei respondendo a todos vocês. Muito obrigada. Estou terminando o programa Infertilidade em Foco. E gostaria de agradecer o convidado de hoje, Dr. Ayman Attar. Ele que é autor do livro Ginecologia Cosmética. Um grande amigo que eu tive o prazer de conhecer, e iremos dar prosseguimento ao nosso projeto no próximo ano. Estaremos juntos ministrando o curso de Ginecologia Cosmética no Brasil e em Portugal. E te agradeço imensamente por fazer parte do nosso time de especialistas melhores do mundo. Muito obrigada. Thank you.